Hello everyone. Hereby, I am presenting my best IPHA 2025 essay winning on topic Health is a Right, Facts and Myths. Dr. Preetham K.S. Gowda, Junior, Department of Community Medicine. Introduction. If access to healthcare is considered a human right, who is considered human enough to have that right? Paul Farmer. The right to health is a comprehensive fact and limited misconception in the field of health economics of an individual's and states. As per many health analysts and activists, health is not a constitutional right, which is an indirectly against the definition of the right to health. The enjoyment of the highest attainable standard of health without distinction of race, religion, political belief, economic or social condition. In one of the views, highest health standards, ensuring the physical, mental, and social well-being of an individual completely depends on other fundamental rights like the right to a home, proper nourishment and nutrition with living in a dignified condition, the right to work, which covers the needs of adequate lifestyle, right to education, to ensure free schooling and composite knowledge to work, right to equality, which actually explains the statement of universal coverage in health without any discrimination. All are in flow and interconnected with multiple factors that influence each other to enhance the living standard of the common man. But unfortunately, these factors are wicked with a lot of hidden facts. Towards health is rights or health is right, not be misconceptualized. In ancient times, certain believed that being sick was a sin, which implies that the responsibility is not to feel sick by self-care and self-seeking, preventive medicine, for good health. Later, when the health system evolves with democratic rules and government assurances
Hereby,
to provide
presenting
and subsidized IPHA 2025 essay winning that it is the state or government's
is a right.
responsibility. Facts
So it
and
becomes
myths. A fundamental right. Health is a right.
So,
Facts any health
and
issues in
myths.
society must be addressed
Written
by
by
both
myself.
administration
Name.
and health
Major.
services provided
Dr.
under governance.
Preetham K.S. Gowda.
Later,
Junior.
people start neglecting
Department
their health
of Community
preventive
Medicine.
aspects
Introduction.
and blaming the authorities
If
for
access
death
to
due
healthcare
ill
is
health, considered a human
which
right,
indirectly
depends on
who
other
is
fundamental
considered
rights,
human
like
enough
education,
to have that
house,
right?
clean water and
Paul
air,
Farmer.
nutrition.
The right to
etc.
health is a comprehensive
recent
fact
years, and limited
universal
misconception
health coverage
in the field
is an
of health
emerging
economics
concept
of an
to provide
individual's
comprehensive
and
health
states,
care
and to reduce the
As
financial
per many
burden
health
on
analysts
fundamental
and activists,
health services. Health is not a constitutional
Money
right,
is a virtual
which is an
key
indirectly
social
against the
determinant
definition
for the standard
of
of
the right
living,
to health,
which
influences health
the
economics
enjoyment of the
to take
highest
over
attainable
our
standard
health
of
rights
health into
without distinction of
commercialization,
race, in which
religion,
they decide
political
your
belief,
health service
economic
will be covered
or
in
social
different
condition.
policies and schemes. In one of the views, I want to highest critique health the standards, way which ensuring politically the physical, between mental, the service and provider social well-being and critical of an individual need for execution completely depends to the on common other
man.
fundamental rights,
Now,
like the right
everyone
to a home,
needs to awaken
proper
and
nourishment
accept the knowledge
and
of good
nutrition
health
with
and to
living
be
in a
healthy.
dignified condition.
In my view,
The right to
good
work,
health is one's
which
right,
covers the needs of
and
an
to be
adequate
healthy
lifestyle,
is the responsibility
right
of
to
every
education,
human being.
to ensure free
Facts.
schooling and composite
Every
knowledge
man
to work,
has a right to his opinion,
right to equality,
but no man has a
which
right
actually
to wrong
explains the
in his
statement
facts.
of universal coverage in
Bernard
health
M.
without
Baruch.
any discrimination.
In my persuasive narration
All
of
are
the
in
topic,
flow
it
and
is difficult
interconnected
to
with
explain
multiple
the
factors
exaggerated
that
dark
influence each
truths
other
or
to enhance
facts
the living
about health
standard
rights.
of the common man.
But certain documented
But unfortunately,
and objective facts
these factors
about health
are
rights
wicked
are
with a
my
lot of
focus
hidden facts.
in writing.
Towards
Although
health, any
is
facts
rights
that matter
or health
are
is
experimented,
right
not
and
be
proven.
misconceptualized. Starting with
In
United
ancient
Nations
times, certain
WHO
believed that being
Constitution
sick in
was
1946,
which
states
implies that the responsibility
right to health
is not to feel
a
sick
human
by
right
self-care
enshrined
and
in
self-seeking,
international human
preventive
rights
medicine
law.
for good health.
Later, in 1966,
when the health system
International
evolves
Covenant
with democratic
on Economic,
rules
Social,
and government
and
assurances
Cultural Rights
to provide free
under Article
and
12
subsidized health
extended
services,
the right to health
people start
as an
thinking
inclusive right
that it is the state
not
or
only to
government's
timely and
responsibility.
appropriate health care,
So it becomes
but
a
also
fundamental right.
to the underlying determinants
So,
of health,
any
such
health
as
issues
access
in
to
society
safe water,
must be
sanitation,
addressed by both
occupation,
administration
and health-related
health
education,
services provided
without
under
any kind of
governance.
discrimination at
Later,
any stages.
people start neglecting
In
their
India,
health.
Article
Preventive
21
aspects, guarantees
and blaming
a
the
fundamental
authorities
right
for
to
death
life
due to ill
and
health,
personal liberty,
which indirectly
and it is
depends on
inherent
other
to
fundamental
life
rights
with dignity.
like education,
Also,
house,
Part 4
clean
of the
water
Constitution,
and air, nutrition,
DPSP,
etc. Articles
in recent
38,
years,
39,
universal health
42,
coverage is an
43,
emerging concept
and 47
to provide comprehensive
put an
health care
obligation on
and
the
to
state
reduce the
to
financial
ensure the
burden
effective
on
realization
fundamental health
of the right
services.
to health.
Money in its landmark
is a virtual
judgment
key
of
social
Patmanand
determinant
Katara versus
for the
Union
standard
of
of
India,
living, which influences health economics.
The Supreme
to
Court
take
ruled
over our
that
health
every
rights
doctor,
into commercialization,
whether at the government
in
or
which they
otherwise,
decide your
has a
health
professional
service will be
obligation
covered
to
in
extend
different
his policies
policies
and
with
schemes.
due expertise
For
I
protecting
want to
life.
critique the way
It
which
again
politically
emphasizes
entangled between
getting
the service
healthcare
provider
service
and critical
for
need
life
for
is our
execution
right.
to the common man.
In simple words,
Now, the fact
everyone
is
needs
that
to
health
awaken
governance and
accept the
ministries
knowledge of
must
good health
respect
and to be
protect
healthy.
and fulfill the
In
health
my view,
needs of their
good
citizens,
health is one's right,
including
and
access
to be healthy
affordable health
is the responsibility of
essential
every human
medicines
being.
and treatment,
Facts.
adequate nutrition,
Every man has a
clean
right
water
to his opinion,
and sanitation,
but no man
using
has a
its
right
composite
to wrong
financial
in his
and
facts.
social resources.
Bernard M.
In reality,
Baruch.
violations
In my
of this right
persuasive narration
not
of the
only
topic,
contribute to
it is
and
difficult
exacerbate
to
poor
explain
health,
the
but
exaggerated
for many,
dark truths,
including
or
migrants,
facts about
people
health
with
rights.
disabilities,
But
indigenous
certain
population,
documented
and objective
PLHIV
facts about health rights,
sex workers
are my focus
transgender
in writing,
etc.
Although any
healthcare
facts
setting
that matter
presents a
are
risk
experimented
of heightened
and
exposure
proven,
to human rights abuses,
starting with United
including
Nations
coercive
WHO
or forced
Constitution
treatment
in
and
1946, states
Thus, the right
non-qualified
to health,
doctors,
a human
rise
right
in numbers,
enshrined in
contributing
international
to
human
wrong
rights
treatment
law
and ill health.
Later,
in
many
in
citizens.
1966,
An
International
unacceptable
Covenant
fact is
on Economic,
there is
Social,
discrimination
and Cultural
in healthcare
rights
access
under
and
Article
treatment.
12 extended the right
Those
to health
important
as an
factors
inclusive
are
right,
rich
not
and poor,
only to timely
gender
and appropriate
disparity,
health care, but
educated
also to
and
the underlying
uneducated,
determinants of health,
disabled
such as
and
access to
healthy,
safe water,
etc.,
sanitation,
are routine
occupation,
and
and
seen in
health-related
society.
education,
The
without
fact
any
towards
kind of
providing good
discrimination
health
at any
/
stages.
health rights in India
is
Article
facing
21
a lot of challenges,
guarantees a
like
fundamental right
inadequate
to
healthcare
life
infrastructure
and personal liberty,
lack of doctors and beds,
and it is inherent
high
to
disease
life
burden
with dignity.
NCDs,
Also,
and
Part
limited
4
health
of the
financing.
Constitution,
Only
DPSP,
2.1%
Articles
of GDP,
38,
39,
and facts.
42, 43,
Humans
and
tell
47
myths to explain what
put an
they
obligation
cannot
on the state
understand.
to ensure the effective
Anonymous.
realization of the
1.
right to health.
Myth. In its
The
landmark
right to
judgment
health
of
means
Patmanand
that everyone
Katara
is entitled
versus
to
Union
receive
of India,
all medical
1989,
treatment for free. The Supreme Court ruled that every doctor,
access to
whether
healthcare
at the government
services
or
doesn't
otherwise,
necessarily mean
has
that
a professional
all healthcare
obligation to
services
extend
are free.
his services with
Rather,
due expertise.
it focuses
for
ensuring
protecting
on the
life.
availability and
It again
quality of
emphasizes
services.
getting
But the
healthcare
specifications
service
beneficiaries
for
and
life
their facilities
is our right.
can vary
Based
in
on
simple
country
words,
policies, the
and
fact is
resources.
that health governance
2.
and ministries
Myth.
must respect
The right to health
protect,
is only
and
relevant
fulfill
in
the health
developing
needs
countries
of their citizens,
Fact.
including access
It is a
to
universal
affordable healthcare
human
services,
right, regardless
essential
of their
medicines
country
and
or
treatment,
economic status.
adequate nutrition,
All countries work
clean
towards
water
fulfilling
and
this right
sanitation
for their citizens.
using its composite
3.
financial
Myth.
and social resources.
The right to health
is
in reality
not legally binding.
Violations
and
of this
no
right
monitoring
not only contribute to
fact
and exacerbate
it's
poor
legal
health,
to abide
but for
under
many
international human rights
including
treaties,
migrants,
like
people with
in
disabilities,
1966,
indigenous population,
IPHA,
PLHIV,
under Article 12,
sex workers,
etc.
transgender,
Also,
etc.
it mandates the special
healthcare
rapporteur
setting
at the
presents
UN
a
level,
risk of
which
heightened
closely
exposure
monitors
to
countries
human rights
and their
abuses,
state with various
including
policies,
coercive
regulatory
or forced
bodies,
treatment
NGOs,
and procedures,
commissions,
Thus,
etc.
non-qualified
Administration
doctors
monitoring,
rise
which uses
in
the
numbers,
local judiciary
contributing
for resolution
to wrong
of
treatment
violations
and
of
ill
the right
health
to health
in many
under
citizens.
rules of ICESC
An unacceptable
Article
fact
12.
is there is discrimination
Myth.
in healthcare
The right
access
to health
and treatment
is only concerned with the
Those
delivery
important
of health
factors
services.
are rich and
Fact.
poor,
The
gender
realization of
disparity,
other factors
educated
like safe
and
water,
uneducated,
sanitation, nutrition,
disabled
and
and
housing,
healthy,
discrimination, poverty,
are routine
stigma,
and seen
and
in
other
society.
socioeconomic determinants
The fact
of health
towards
should
providing
be
good
addressed.
health/health
Conclusion.
rights in India is
Rights are made to
facing a
protect
lot of
the
challenges,
liberty of citizens,
like
and to
inadequate
protect
healthcare
from
infrastructure,
exploitation of
lack
those
of doctors
basic
and
needs
beds,
of humans.
high disease burden,
In the same
NCDs,
context,
right
and
to health
limited health
ensures the
financing,
constitutional
only
security
2.1%
for citizens to
of
protect
GDP.
from catastrophic
Myths
health events
and facts.
through different policies,
Humans tell
regulations,
myths
and
to
explain
commissions
what they cannot
concerning
multiple
understand.
international treaties.
Anonymous.
By knowing the
1.
facts and myths
Myth.
of the concept,
The
we
right
cannot
to health
conclusively
means
say
that everyone
any
is entitled
abuses
to
or
receive
violations
all
of the
medical
right to
treatment
health
for free.
But yes, there is confusion
Fact.
in the common man
Access
about
to
whether
healthcare
health
services
is an
doesn't
individual
necessarily mean
responsibility
that all
or
healthcare
a state
services
issue.
are free.
Also,
Rather,
it's
it
easy to
focuses
see the
ensuring on the
interdependence of
availability
fundamental
and
rights,
quality of services.
but it's not easy
But the
to
specifications
intersectoral
of beneficiaries
collaboration
and their facilities
execution
can
for the
vary
beneficiaries
based on country
in any
policies
system of
and
health
resources.
and countries.
2.
The core
Myth.
minimum obligation
The right
of
to
states
health
is
only
only
relevant
relevant in developing
protect,
countries and fulfill the
Fact.
minimum human
It is
health
a
standards
universal human
by
right,
using resources
regardless
on
of
a
their
discriminatory
country or
basis.
economic status.
Simultaneously,
All countries work towards
citizens
fulfilling
should
this
not
right
blame the
for their
facts of
citizens.
health rights,
3.
but rather accept
Myth.
the flaws in every
The right
stage
to health
of administration
is not legally
and execution,
binding,
and no
Try to
monitoring.
look
into positive aspects and
It's
own
legal to
responsibility
abide under
towards
international
having
human
joyful
rights
health
treaties
and,
like,
if
in
possible,
1966,
provide the contribution to the
ICESC
country as such.
under Article 12,
It helps to attain
etc.
the state of
Also,
non-exhaustive
it
health
mandates the
and
special
well-being
rapporteur
for
at the
all.
UN level,
A
which
right
closely
delayed
monitors
is a
countries
right
and their
denied.
state with various
Martin
policies,
Luther King.
regulatory bodies, NGOs, commissions, etc. Administration monitoring, which uses the local judiciary for resolution of violations of the right to health under rules of ICESC Article 12. Myth. The right to health is only concerned with the delivery of health services. Fact. The realization of other factors like safe water, sanitation, nutrition, and housing, discrimination, poverty, stigma, and other socioeconomic determinants of health should be addressed.
Conclusion.
Rights are made to protect the liberty of citizens and to protect from exploitation of those basic needs of humans.
In the same context, right to health ensures the constitutional security for citizens to protect from catastrophic health events through different policies, regulations, and commissions concerning multiple international treaties. By knowing the facts and myths of the concept, we cannot conclusively say that any abuses or violations of the right to health. But yes, there is confusion in the common man about whether health is an individual responsibility or a state issue. Also, it's easy to see the interdependence of fundamental rights, but it's not easy to intersectoral collaboration and execution for the beneficiaries in any system of health and countries. The core minimum obligation of states is to respect, protect, and fulfill the minimum human health standards by using resources on a discriminatory basis. Simultaneously, citizens should not blame the facts of health rights, but rather accept the flaws in every stage of administration and execution. Try to look into positive aspects and own responsibility towards having joyful health, and, if possible, provide the contribution to the country as such. It helps to attain the state of non-exhaustive health and well-being for all. A right delayed is a right denied. Martin Luther King.